If hip and knee pain is preventing you from enjoying life, then you got to check this out. There's a new high-tech way to help restore your body to its younger days, and it's available right here in Connecticut. And joining me now is Dr. Scott Stanat and Dr. William Cambridge, orthopedic surgeons at Bakus Hospital in Norwich, Connecticut. Guys, thank you for joining us here today on CT Style.
Thank you.
Thank you.
So let's get right into it. The pain, a lot of our viewers are dealing with it. What are some ways to prevent the surgery in the first place?
I think the first approach probably to arthritis is something that people don't want to do, and that's using a cane.
Okay.
You can unload the joint. It's safe. You're not dumping chemicals into your body to correct the pain.
Do you find that some doctors over-medicate for arthritis and different pain medications like that?
I think it's very easy to over-medicate a patient with degenerative arthritis. It is a progressive disease. As a rule, it has no cure. And to get them hooked, for instance, on an antibiotic, or not an antibiotic, but a narcotic or a controlled substance is a mistake.
Okay.
And I think also by staying healthy, keeping your weight down, keeping your joints mobile helps prevent it from actually occurring, but then also trying to stay away from injury and just doing everything correctly. So that's important too.
Say you're younger and you recommend using a cane, but somebody might not feel comfortable using a cane. There's always the surgery. It's called MAKOPlasty.
Well, that's reserved for later.
Okay.
There's a sequence of steps people generally go through.
Okay.
Many times arthritis doesn't progress to the point where you need surgery. People can live with that everyday pain, taking an anti-inflammatory medication. When it comes to surgery, Dr. Stanat and I both do hip and knee replacement surgery. That's when the pain becomes disabling. It interferes with your quality of life. It affects your family. It affects everybody around you. It can become a psychiatric issue with depression. And that's when people have to come to grips with, how do I want to handle my quality of life at this point? Do I want to commit myself to an operation, or do I want to stay like this?
And I think that sort of once you've passed that where the pain is really affecting your quality of life, with the joint replacements that we perform, many people get better and are very happy after that fact. Now the newer procedures allow us to do smaller surgeries. We can do partial knee replacements or resurfacing, and that allows some people to actually choose a surgical option earlier to get their quality of life back earlier when they might have had to wait years before, if they needed a full knee or something like that.
Dr. Stanat, what would you recommend to patients who are maybe a little afraid of getting the surgery with talking about the benefits of the actual surgery? How are you going to feel after?
Well, once we perform the surgery and then actually get your knee or hip rehabbed appropriately.
How long does that take?
Well,
approximately.
You're up and walking either later that afternoon or the next morning.
Oh, really?
Full weight bearing in general. Some people spend one night in the hospital. Some people spend a couple nights in the hospital, but many people are up and walking fairly efficiently.
And we have some photos here that we're showing our viewers that you guys can kind of walk us through a little bit here.
Here we are doing a teaching session, and this is us using the robot looking at a CAT scan of a hip joint here. And we're actually, you see the robot in the background there. And what we're doing is trying to assess the hip joint that we see during the surgery with the CAT scan that we have before, orienting the robot that's going to help us in the surgery, perform the surgery more accurately here.
Okay.
And then here we're reviewing the preoperative imaging there, meaning the CAT scan that the patient had before, and where we intend to put the joint replacement to try and get the best, most optimal alignment and result.
And then we have another photo here.
That is the whole key with the Mako, though. We can actually do the surgery, plan the surgery without having operated on the patient. The whole surgery is planned out before we even...
So it's like measure twice, cut once. No pun
intended.
It's
even better than that.
So it's like measure four times, five times, something like that? Okay.
Well, we can play with this thing, and we can control the depth of the hip socket. We control the size of the femur, the offset. It just makes the surgery a lot more predictable. There's a difference between accuracy and precision. Accuracy is like throwing a piece of paper into a weights basket. 1 or 2 out of 10 times you'll have an accurate shot. Precision is hitting it
10 out of 10.
10 out of 10 times, and that's what you can do with this Mako. You can hit that target 10 out of 10 times.
And I think part of it here is that also we've been able to measure and predict and try and, what we say, template in our business, but with the robot it helps us ensure that what we wanted to do preoperatively we're doing with precise and accurate placement intraoperatively with the robot. And so that it gives us a little bit extra step to make sure that everything's done exactly how the surgeon wants it to be done all the time.
Well, it sounds like a very new and accurate, well, not accurate, a precise procedure with all the new technology of the MAKOPlasty. So make sure that you guys check them out for more information. All you have to do is Google Bakus Hospital, log on to bakushospital.org, and Dr. Stanat and Dr. Cambridge can help you out with that. Now,